From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Okay, good morning. This is Dr. Paul. Thank you for tuning to our channel today. And this afternoon I want to talk about a few minutes about the tragic death of Whitney associated with drug abuse. You see, we hear about these big celebrities like Michael Jackson and Tim Hardin, Janis Joplin, Marilyn Monroe. And when we hear their stories and how they abused prescription drugs and fell victims to a premature death, and when we hear these stories, I mean, it's always better to think about the larger spectrum of things. Now we have these celebrities, and when you look into their life, they've got everything. They signed like $100 million contract, selling like 150 million albums a year. They live in multi-million-dollar mansions, fly private jets. They have thousands of fans and admirers wherever they go. And today, New Jersey Governor Chris Christie actually called for all the U.S. flags to be flown half-mast. I mean, what a joke. She was not a firefighter who died while saving lives. She was not a policewoman who died while fighting with some criminals. She was not a soldier who died in some Afghanistan while fighting with a terrorist. She was just a singer. I mean, she has a beautiful voice, and she sang so many inspirational songs that inspired all of us, but still, I mean, that's a little bit overreaching of things. Now, let us come to the problem. You see, when we hear about these big celebrities dying of drug abuse, we feel sorry for them, but we do not look at the big problem. United States, for example, has 5% of population, but 25% of all controlled drugs are abused in this nation. 25%. So 5% of the population, I mean world population, abusing 25% of the world's drugs. So this problem is a big problem here in America. Now let us go to the particulars. There are four main classes: stimulants, anxiolytics, opioid medications, and other classes. Now I want to give you some definitions before I go into particulars. First of all, prescription drug abuse involves using a medication, often by self-administration, in a manner that deviates from medical, legal, and social standards. If you take DSM-4, we have this, like the drug use constitutes is a maladaptive pattern with recurrent and significant adverse effects, such as failing to fulfill major role obligations, legal problems, physically hazardous use, and interpersonal problems. And there is a prescription drug addiction, which is a chronic neurobiologic disease characterized by impaired control over drug use and compulsive use, continued use despite harm and cravings. Now the types, let me talk about the types. Types of most commonly addictive substances. Number one, stimulants. Stimulants are like amphetamines, like Ritalin. Then there is anxiolytics like benzodiazepines like Ativan. Number three is opioids like painkillers like Vicodin and Percocets. Then number four, other drugs like anesthesia, the dissociative anesthesia. So stimulants, anxiolytics, opioids, and other drugs like dissociative anesthesia. So these are the four most commonly abused drugs. Now regulation, if you are a doctor in the United States, you want to prescribe these drugs, you need to register with Drug Enforcement Administration. They give you a registration number, and you need to write this registration number on every prescription you write. And there are schedules: Schedule 1, Schedule 2, Schedule 3, Schedule 4, Schedule 5. Let us see these schedules. Schedule 1, highly abused potential medications. There are no accepted use for these drugs in medical practice, so they cannot be prescribed. These includes like heroin, lysergic acid ethylamide like LSD and mescaline. So Schedule 1 drugs cannot be prescribed. They cannot be prescribed, remember that point. Then Schedule 2 drugs, they have high potential for abuse and dependence. There are accepted medical indications with severe restrictions. So Schedule 2 drugs, you can write a script but no refills. So you need to write a script with your DEA number but no refills. They include morphine, codeine, methadone, oxycodone, hydromorphone, meperidine, fentanyl, cocaine, amphetamines, and dronabinol and secobarbital. So all these comes in Schedule 2. Then Schedule 3, the abuse potential is less than Schedule 2 drugs, compounds with limited quantities of controlled substances. So Schedule 3 drugs, you can write them, and generally they require prescription refillable up to 5 times within 6 months period. So you see Schedule 2, no refills. Schedule 3, up to 5 refills in 6 months. Remember that point. Schedule 2, no refills. Schedule 3, 5 refills in a 6-month period. So Schedule 3 includes like Tylenol with hydrocodone, buprenorphine, those kind of drugs. They come with Schedule 3. Then Schedule 4, the abuse potential is less than Schedule 3. And Schedule 4, there are accepted medical indications for Schedule 4. And generally they require a prescription, and you can give a refill. You can write refills also, like up to 5 times in a 6 months period. And so you can write a refillable prescription with these medications. They include benzodiazepines and propoxyphene and pentazocine, phentermine, and phenobarbital. Then Schedule 5 drugs, they are like much less addictive. They are addictive. People are using these medications, but still Schedule 5 is less than Schedule 4. And they include like non-prescription antidepressives and antidiarrheal medications like diphenoxylate and pentoxifylline and buprenorphine. Those are the medications. So 5 schedules, remember those things and how you can fill them, because if you are a medical doctor, you will be prescribing these medications almost on a daily basis. Now, millions of people here in America are abusing. I'm not talking about using appropriately. I'm talking about people who are actively abusing these medications. And that is actually growing in the problem. The problem is expanding year after year. And most commonly abused medications are painkillers. That's an important point. Painkillers are the most commonly abused controlled drugs. So remember that point. Painkillers are the most commonly abused drugs. And the growth in availability of prescription drugs comes from several factors. They are increasingly produced, and there is a lot of these medications are being diverted, and there are counterfeit drugs. Nowadays, the internet has actually made a global marketplace for these drugs. You can order these drugs from Nigeria while sitting in the United States. So even if you go to porn websites, the porn website, they will put some porn and they write, do you want Viagra? Do you want Vicodin? Do you want Percocet? So on the internet, this problem is increasing so much. And there is also increased diversion from regular medical doctors. And what happens with these medications is like they produce dependence. They give like a brain reward. What happens is when people take these medications, there will be a surge of dopamine release. So there is a release of dopamine from midbrain, especially from nucleus accumbens. So the brain produces a lot of dopamine, and that dopamine release gives some kind of brain reward to the people who are abusing these medications. So the dopamine release is responsible for the brain reward. That's an important point, folks. There are medications that act on brain like antidepressants like Prozac or some anticonvulsants like lithium, but they don't release dopamine. But these abusing medications, they actually release dopamine, and they give that brain reward system. Now people use these medications. I mean, when you look at this problem, you need to think at the individual level, the family level, and the doctor level, and also the drugs which give that immediate release. I mean, they are mostly abused. I mean, if they have a rapid onset problem, like people go after them, they have a high market value. I mean, we call this the street value. They are highly preferred. If they give, like, you go on high very quickly. And people who take, if they have a easy access, like IV access, then they are most highly favored. And if the drug addiction medication is more available, then it is easy to get. But their market value rises with the rapid action. That's important. And people who come from homes with drug abuse, already daddy probably using marijuana, mommy is also drinking alcohol and using marijuana, then their kids are more vulnerable to the drug problems. So you see, there are the sociological factors involved with this problem, and clinicians many times they fail to see this. And even I was like, when I just started medical practice, I took everybody at face value. When they said, I have so much pain, I was writing Vicodin. But with time I realized these people are just abusing these drugs. They go to different doctors and they pick up these narcotics from different doctors. And finally you feel you are deceived by them. So deception is a very, very common thing in this problem. Then sometimes doctors get distracted. Like, for example, if they are busy and somebody comes with back pain, oh, my back pain is killing me. Oh, give some Vicodin for this patient, get rid of him so that I can do more important stuff. So sometimes doctors get distracted and they write these prescriptions. Sometimes doctors get disabled. They themselves might be using these pills and they become dependent. They are diverting this medication. Probably they are self-prescribing or prescribing to a family member who give the medication back to the doctor. So many times that diversion happens when the doctor himself is abusing these pills. So doctors can be deceived, they can be distracted, they can be disabled, they can be dishonest. There are doctors, who write all kinds of these narcotics to junkies once they walk into their doors, because you see, more patients you see, the more money you get. So there are dishonest doctors. Many of them are in prison now, who are like giving out these medications. And if you take for example, disciplinary actions by state medical boards, and you see many of them being disciplined for giving narcotics in dishonest ways. That happens all the time. Doctors getting public reprimands or their licenses being revoked and cancelled or suspended. And that's happening because doctors also sometimes become dishonest, and to make money they give out these prescription pills more and more. So the other thing is many of these people addicted to drugs, they go to emergency rooms, they go to urgent care centers, and you see emergency department visits in the last 5 years almost doubled. And because why? Because people go there and they present some, oh, I'm having a lot of chest pain, give me some Percocet. Oh, I'm having a lot of knee pain, I fell down on the couch, give me some oxycodone. So they just crowd these emergency rooms. And we blame presidents and congressmen and senators what's wrong with the healthcare system. But we need to see people are abusing the healthcare system so much. There are people who go to the emergency room almost like a weekly basis to get these narcotics. It's like you would see the figures like $8.6 billion are costing just by the drug problem. So you see, folks, this is a very, very common problem. So this is a lengthy video, and I am going to talk more about this in my next video. So follow me in the next video. So in this video, I have presented the 5 scheduled drugs, the 4 most common types of drugs, and the impact of this problem on the healthcare. How people, they deceive medical professionals to get these medications. I talked about why doctors give them. They are being distracted, they are being deceived, they are being dishonest, they are being disabled. Those are the things I have seen. In the next video, I'm going to talk about what kind of methods people use to deceive doctors to get these medications. And follow me in that video. Thank you very much. Have a nice day.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.